Today is your which day?
The 9th day.
9th day. So you're going back to US?
Yes.
Flying today?
Flying today.
Good. So could you just put in 3-4 lines short that how was your experience
Oh
about
my
the surgery
goodness, it was
and your stay here?
unbelievably smooth. I felt like, even though it should be counted as a major surgery, but I felt like it was maybe easier than going to a dentist.
Uh-huh.
I was up and running. There has been no pain, no nausea. Emotionally, I feel okay. I feel balanced. I guess because I could get up really quickly, move, eat, and talk and laugh. So I really did not feel like someone in a hospital at all.
Good.
Which
good,
is
good.
which is really good. Emotionally, it keeps you sane.
Yeah, this is the reason why we love mini gastric bypass.
Yeah.
Because our patients are so happy after this
Yeah.
surgery. The reason is very little nausea.
Yeah.
If we talk about nausea, how much it was in your case out of 10? Was it 1, 2, 5, or 0?
It was 0.
It was 0.
0.
So
No
see,
nausea.
after bariatric surgery,
Yeah.
to say that we can have 0 nausea is something unbelievable.
Yeah.
It was like, if we talk about 20 years back, nobody would have imagined that this is going to be possible.
Yeah.
Because bariatric surgery means making the things tight inside so
Yeah.
that you cannot eat, and that indirectly means nausea and some
Yeah,
vomiting.
true,
So-
yeah.
And if you're not having vomiting, no nausea, then how are you losing weight? Did you check your weight?
I've lost about 5 kgs.
5 kgs
Yeah.
in 9 days.
Yeah, that's not bad.
And that too, you were a low volume eater. You were not
Correct.
eating big volumes.
No. Eating
So,
big volumes
yeah.
has not been an issue with
Yeah,
me.
that has never been
generally,
an
no.
issue with you. So your issue was more of absorption.
Yeah.
Your body was conserving everything.
Yeah.
So that was the reason in your case. And that is why we tell our patients to have the gastric bypass, the mini gastric bypass, because it decreases your absorption as well.
Right.
Especially in low volume eaters. The reason is not that they are eating too much. The reason is their body is absorbing too much.
Right.
So until unless we give them a good bypass, they don't show result.
Correct.
So that's what happens with restrictive techniques in such patients who are low volume eaters.
Right.
You will not see very good result with restrictive technique, but with malabsorptive technique, you get a better result. I would say we should not call it malabsorption. We should rather call it balanced absorption.
Better absorption.
Balanced. You
Okay.
want to say better? So, good thing about mini gastric bypass is that it lets you eat.
Right, it does.
But you should know you need a healthy diet. It's
Right.
going to decrease your size.
All right.
So we want to become thin, not weak.
Right.
So what is healthy diet? That would mean more of proteins,
Right.
basically. Protein is, you can say it's the cement of our body.
Right.
It is the most important matter in our
Building
body.
block, yeah.
So the building block. So you, as you are a vegetarian, you need more of milk products.
Right.
So skimmed milk or yogurt.
Sounds good.
Plain yogurt is very good.
Yeah.
Rather, I would say yogurt is even better than milk because it
Okay.
has got lactobacillus bacteria in it, which is a very good bacteria for our intestine.
Right.
It would decrease your gas formation in the intestine, and it would give you more comfortable tummy after eating, right? So yogurt should be like your medicine 3 times a
Alright,
day.
3
You
times
should
a
be
day.
taking it with
Alright.
every meal.
Sure.
Because one bowl of yogurt gives you about 350 milligrams of calcium as well. So
Sounds
it's equivalent to taking one big tablet of calcium.
Okay.
Then you need to go out in the sun at least 20 minutes in a day
Will do. Yeah.
to have a good vitamin D3. Punjab, here we have sun,
All the time, yeah.
all the time in the year. So you can have some room on the top of your home, or maybe on one side where more of sun rays can come. So you can have one wall made of glass only, so that a lot of sun rays are getting in. So you should try to do something like that
We'll do
to
that,
have
yeah.
good bone health.
Yeah.
Mills have this problem. It's a kind of general disease for everyone. It's the
Okay.
gift of our progress, of our developed nation. That's the reason why our vitamin D3 is low. So
Right.
now it's, as you said, the absorption would become better.
Yeah.
The proof going to be is
The
that
numbers.
after 1 year,
Yeah.
this vitamin D3 will increase.
Right.
The levels will increase. Although the absorption will decrease, but because now you are a more learned lady, Now you know
Right.
your vitamin D3 is this much.
Right.
It can go down. Now you'll be
Right.
taking the tablet every day.
Right.
That is the reason why it goes up.
Right.
You'll be going out in the sun. So
Yeah.
that's what we see in most of our patients. Their iron levels go up, calcium goes up, proteins go up. If you calculate earlier, how much protein you were taking in a day. You need 80 grams.
Probably
For
not
that,
80, yeah.
you can just Google
Yeah.
anything, whatever you eat, you can just check how much protein it has in it.
Yeah.
Like one bowl of your dal, lentil, it has about 6 grams of protein. So how you're going to make 80 grams? Multiply it with 14.
It's not really. It's
Yeah,
not really
14
easy.
balls of
Yeah.
dal you were not taking earlier. So
No, yeah.
then at least 2 liters of milk
Yeah.
you were not taking.
No.
Everyday chicken, you're a vegetarian.
Yeah. No.
So 7 or 8 eggs you were not taking.
No.
So that means you were taking around 30-40 grams of protein.
Most likely. Yeah.
Yeah, half of your daily requirement you were taking. That's the reason why we get more of the fat inside. If you take a lot of protein, then your muscles would be heavier and you will have less fat in your body.
Right. Got it.
Yeah, so now you're better learned, you know you need 80 grams of protein.
Yeah.
You can take protein powder, high protein
I
powder
have it.
extra.
Yeah. Yeah.
So make it 80 grams.
Got it.
Then start doing some exercise after 1 month of surgery so that
Okay.
your muscles start gaining weight,
Okay.
but your body loses weight.
Got it.
So that your only fat content goes down and your protein content goes up.
Got it.
That will give you energy.
Okay.
If you talk to any patient who has lost significant amount of weight, 3 out of 10 patients would say our energy levels are very low.
Oh.
The
okay.
reason is they're not taking proteins.
All right. Okay.
So, and they are not doing exercise. So those clear to us. Our illiterate patients who are working in the fields, who even forget about taking their vitamins, but they are taking good amount of milk every day, and they are doing work in the fields, they never feel tired.
Yeah.
They have even lost 100 kilos and still they say we are at the top of the world.
Right. Right.
Because they are putting their muscles to work every day, and if you stretch your muscle is going to absorb protein, it's going to gain weight.
Okay. Right.
So if you tone up your body, your energy levels increase,
Yeah.
and the baseline is that you should have at least 80 grams of protein every day
I'll make sure I do
and
that. Yeah.
do some toning up of the body.